we have private security agencies, and in many of these bars, these are the people who man them. When we talk of, for example, ensuring that the people who are going to those bars or nightclubs are not underage, those are the same people that we have to enforce the private security agencies against. So I would want to know whether this is how you perceive or you say the implementation of this law, and therefore what role will they play under this. Thirdly, you talked about alcohol being contributing a big percentage of the crime, and you've given examples of domestic violence, traffic offences, and you say this is just including but not limited to. We would want to know the exact scope of what are those categories of crime that are alcohol related, if they are beyond the two that you have indicated. But also give us the statistics. You just say a big percentage of the crime. How big is that big? Is it 10%? Is it 20%? We want to get clear statistics so that we can have a more informed position on this matter. Thank you.
Thank you so much, Honorable Chair.
Honorable Chair, congratulations to the Deputy IGP for the appointment. I salute their presentation. However, I have a few concerns. The first one being the effectiveness of enforcement. Because I can see from the figures of the existing legal framework, the proponent of this bill makes mention of the fact that enforcement has generally been very poor. And enforcement squarely falls with the police. I want to understand what assurance we can get that with these new proposals, because even with the old legal framework, there were already issues. What guarantee do we have that enforcement now will be much better with the new proposals? Secondly, at a certain point, police was very popular among the Gen Zs. They had the operation in the night, popularly called the Kawinye Mo. And it was quite a serious one. But now it has died. I want to appreciate from you also what led to, because this was trying to control alcohol consumption. What particularly went wrong with this operation? Thirdly, is on the proposals under clause 1 for public service vehicle, where the police is proposing that we should include water vessels. As far as I'm aware, one of the biggest contributors to our economy is the tourism, and in relations to water, because we have the source of the Nile. When you proceed there, you clearly see how business is booming, and it's a large contributor to our revenue. I want to inquire whether this particular proposal was made with deep reflection on what impact this particular proposal could have on our economy. Because you realize that the number of incidences on water vessels may not be so many, but you could brief the committee also on the statistics of accidents that have happened on water in relation to alcohol abuse, and whether you think it's important for us to totally crush this this aspect of a big contributor to our economy, just on account of maybe statistics that may not be very reflected.
The other issues have really been raised by colleagues. Thank you, Chair.
Thank you so much, Honorable Chair. Thank you so much, Deputy Chair. My name is Jocelyn Kamatenet, woman MP in Tungamo District. I'm sorry I came in late. I had another meeting. My clause 1, public service vehicle, where you're saying include water transport. I think this will be so unfair to our economy, to our country. I suggest maybe if we can restrict the drivers, I don't know if you call them drivers, those who drive ferries, captains, ferries and boats. Otherwise, people go on these boats, boat cruises to enjoy life for entertainment, for leisure, not for prayers, by the way. There are very few people who go on these boat cruises to go and pray. So if you say they are not supposed to drink and enjoy, I'm very sure you're suffocating the business. You can restrict the captains, but not the people who are using the ferry. 2, about the supermarket and the bars. We know people who own supermarkets are people who are already the elites, the rich ones. Then these people who are beginning small businesses usually own small bars. And we know people who go to those small and beginning bars, low income earners. So if you say they should close bars and you allow supermarkets, where will you put these people who are just beginning, the poor? We are into wealth creation. In bars, people drink water, drink sodas, they drink beers, they drink even these other small liquors that are made locally. So I think the existing laws that we have, if they are well implemented and enforcement is very good, I believe we don't need this law. It is going to destabilize our economy. It is going to disorganize us, especially the leaders. And in the future, you will see what will happen. So let's enforce the existing laws, but these ones, maybe you can put more effort in preaching such that people just get saved out of their willingness, but not bringing this law. Thank you so much.
Thank you so much, Honorable. Honorable Chair.
Thank you very much, my colleague. I would like to colleagues have mentioned. Also, I'll go to the supermarkets and liquor depots. Their proposal was to stop people from opening up bars and encouraging people to drink from home. But sometimes we have to ask ourselves, why do people drink at home? I have an experience. I bought not a large as such, but a bottle of Amarula and left. I used to drink at home. But whenever you could go home, you would find your children, you could find them very happy. So I was wondering, why were they very happy? Because they could access my. So I stopped. I no longer do that. But still, you see, why do people drink from bars? You know, sometimes it's for when you have sometimes stress, sometimes for enjoyment, but sometimes people are stressed. So when you take alcohol at home and you are stressed, maybe because you have some home issues, you may end up becoming even much more violent than when you drink from bars. And as my colleagues have mentioned, when you take alcohol home, the children will access. You know, children can access anything sweet, sour, or bitter. Unless if they notice a drug, they will not take. But when notice a beer, whether it is sweet, whether it is sour, they will take, they will taste, and they will keep on tasting until they become addicted. So with this number 3, that is 14 close to, you have to be very careful about this. Then on number 8, are there no any other laws which can be able to cover this, number 8? I don't know, but maybe we can be able to look at it critically. And my colleagues have already mentioned that also have to look at the economic impact about some of these clauses in the bill, and also there are some existing laws, and also the timing, but we can get views from your responses, and we shall be able to come out with a clean paper to present on floor of Parliament. Maybe also my colleague could be having some input from your presentation. Thank you.
Thank you so much, Honorable Chair and Honorable, for your very good submission. Just for the record, Honorable Kamaternity had her last opinion that she thought the bill is not necessary. That was her personal opinion as a member. Deputy IGP, when you look at this bill and your submission, majority of the colleagues have talked about it. Could you give us these aggregated statistics compiled by Uganda Police on the road carnages, the casual factors being excessive consumption of alcohol, as you have insinuated here, and also on domestic violence? I think majority of my colleagues hinted on it, Honorable Mwichuche, Honorable Gaffan, majority of them here. You have also alluded that excessive consumption of alcohol has led to domestic violence. Could we also have those statistics? Because, honorable members, some still think it may not be alcohol alone. And so if we have the statistics, we'll be able to differentiate. Deputy IGP, in the bill, one of the objectives of the bill is to eliminate illicit trade in alcohol. How do you think illicit trade in alcohol can be handled? And what is your opinion of illicit alcohol? Because in the bill and in your response, you seem to have combined alcohol all together without differentiating the illicit alcohol that has oftentimes led to the very many bad things that we have mentioned here in our submissions. And also, do you have instances where consumption of native liquor leads to unproductive persons from police in your statistics? I thank you so much, honorable colleagues. I think we could let them respond to the very many questions we have put across. I'm sure they will be able to share among themselves, or the Deputy IGP will guide their team on how to move. Thank you so much, Deputy IGP.
Yeah, as we were discussing, I told you I was expecting some 2 officers to join us, and actually they have joined us. That is Muviru, SCP, who is the Director for Forensic Services, and Senior Commissioner Lawrence Niwabine, who is in charge of traffic and road safety. Of course, the questions are many, and we shall, between us, try to respond to them. But I know what has come out very strongly is about statistics. Many of you have raised the issue of statistics, and I think that is what we quoted in our annual crime report for the year 2023. Yeah, of course, that data we may not, I don't know, we may not have really dissected it the way the members have raised, but I think we can have that opportunity and get you the details. Because one, when you realize and you see these road accidents that happen, you remember that time when many buses used to have the accidents. Actually, most of the causes were alcohol. I think the director here can expound on that. So we have the statistics. We can process it further and share with the members. And then what came out is also the issue of selling alcohol and consumption to uniformed vis-a-vis the non-uniformed officers. Honorable members, the Uganda Police Force has a code of conduct. That is, we have our disciplinary code of conduct that checks on every police officer, irrespective of where you are deployed, whether in uniform or in non-uniform. And people should not be worried about whether somebody is a gazetted officer that is having a lot of these things misbehaving, because we have the professional standards unit that checks on everybody, and this unit is in all the regions. Currently, Uganda Police Force has 29 police regions, and we have these officers there. This officer may be of a lower rank. He may not, engage with you physically, but he reports. We have the chain of command. If he sees a senior police officer is misbehaving, he communicates to his superior following the chain of command, and that officer definitely will be handled. So with that one, I believe we don't have challenges. We normally check on discipline of our officers. Of course, corruption is a challenge. We are grappling with the issues of corruption as we implement our mandate. But like I again told you, we have these mechanisms in place. But of course, many members may not know our internal disciplinary mechanisms. Actually, we are trying to bring it out so that people begin to see how we operate. Because most people don't believe that actually we punish our errand officers. So we are borrowing a leaf from the UPDF, where, when something happens with their personnel, they come open to the public, and even where court sits is in public, the community comes and witness. So we are also coming out in that manner to ensure that we enforce discipline and also fight the issues of corruption. We also have the Uganda Police Force anti-corruption strategy, which we are beginning to implement to make sure our officers are accountable. Then the other thing is the uniformed officers. Does it only cater for law enforcement or security personnel generally? Well, what we know is that even the private security officers are being regulated by the Uganda Police Force. We are the ones who supervise them. Actually, we look at their operations, we look at their training. So I think that also may not be a challenge when we are implementing this. Of course, when this law comes into force, we shall then also have to put certain things in place. Because when we are talking about non-access of persons with firearms, we must ensure that the safety of these firearms, whenever presented, is guaranteed. We shall see how to work around that. But for the benefit of members, as you know, we are now going to deploy or implement the sub-county police model. Sub-county police model. Now, this sub-county police model requires that in every sub-county, at least we must have 18 personnel of the different departments, CID, CI, general duty, forensics. Then we must equip them with a communication system and at least 3 motorcycles. Then we provide what they call the counter phone. Now, this counter phone is to enable our communities to quickly report anything that happens to the police. And this motorcycle is to have patrols. That is going to be 24/7. So we believe currently we have about 2,184 sub-counties. That means if a honorable member here is in a district that has maybe 10 sub-counties, now you do the mathematics, okay? 10 sub-counties times 18 personnel times, 3 motorcycles times 10. You see how we shall dominate the space. That means if we are occupied with that number of personnel, with that number of motorcycles, then identification and monitoring of bars within those areas becomes easy. So these are some of the anti-crime structures that we are coming up with. And of course, we also know that implementation of the old laws used to be a challenge, the Nguli Act. The ground setting was, not as of now. These days we have a lot of improvement in technology, the NIN. So I think implementation of this law may not be a very big challenge because of these technologies that we have. But of course, these are things that we shall discuss. Somebody talked about the capacity. So these are areas that we are looking at. Look at the gaps, and then we see what capacity then do we need. Of course, there are challenges, especially with the still training of our personnel, and also equipping them with the proper tools of trade. But these are things that we intend to look at. So basically, that is, for now, what I have. I think my colleagues can add also something as we look at the questions.
Clarification?
Thank you for your new strategy. Is going to cover the entire country. May be very misleading because for this law to be enforced, indeed we need those numbers. But I'm well aware during the budget process that this is going to be a pilot phase in a few as opposed to fully implementation. Can you clarify on this assertion that not the entire country is going to be covered as opposed to what you've just submitted?
Just a quick computation here. The sub-county police model the IGP is talking about, we have 2,184 sub-counties. If we are going to have 18 police officers, that would be 39,312 police officers. Considering the current size of our police force, I want the IGP to also comment on the practicability of this, assuming this is achieved. You have not put those at the headquarters, those at the regional offices, those deployed in special operations. Look at your current total force and the practicability of this proposal.
Excuse me? More information? Thank you so much. I've already said that I'm woman MP in Mbarara district. The whole of my district, the total number of police officers is 85. The whole district. In fact, when you are talking of of 18 per sub-county, I feel bleeding in my heart because my sub-county is the highest, has about 3. The headquarter at Wizwera in Mbarara has not more than 29. And in the whole district, I think I have about 6 or 10 females. The whole district. So my women criminals are always arrested by men. About whatever suspects, they are always arrested by male. So I don't know, as my colleague has mentioned, I don't know whether it's going to be a pilot so that you get a few districts and then you pilot on these 18, uniformed personnel, beginning maybe from the new recruits that you recruit. But it is so bad. If you want to look at this law in relation to those officers, then I think it might not work for us. Because I have complained, I have come to those offices in Naguru looking for more manpower. In fact, when I was talking to my DISO this morning, he was even complaining that more 5 officers were transferred yesterday. So when you're talking of personnel coming to help us in this law, I think we need to work harder in this line.
Thank you so much, Honorable. Could we have the Deputy IGP?
The Honorable Member has done some mathematics.
Yes, Honorable Gaffer.
He has done some mathematics. Yeah, our current strength is 47 now, 47,000. With another 3,500 at Cavalier. So, you see, when we have that number, definitely, we may not just immediately go in there. We are also going to zone the country, okay? And then put a layer. The areas with high crime and that kind of thing, we start with those ones. You get it? And then with many, so we shall have the layering effect. As of now, definitely, we have done a pilot in Masaka. That is where we are. But of course, you also are aware that when we are implementing the PRDP in northern Uganda, actually, we operationalized sub-counties, all sub-counties, at least with 7, we made a standard sub-counties with 7 unipods standard. Now we are saying if we already have 7 unipods, we need few structures in those areas, and then we provide transport, we provide communication. So you find, in a way, you are already operationalizing. In Karamoja, we had 2 projects of KIDTP and DINU. We put up 14 structures, very good structures, 9 housing units each, an office. We even sank borehole, and we have 2 motorcycles already in place. So you find if you already have accommodation for 9 people, what is the balance? 9. Get 9 unipods, add there. You find you have already operationalized the area. So this is how we are actually zoning and going that way. So we shall make it. Yeah, we shall make it. Of course, through your support.
Deputy
Through your
IGP.
support, Definitely we shall make.
Deputy IGP, in case the bill is passed as is right now, do you really have the capacity to implement it as police officers? Because the honorable colleagues have vividly aired it out that as of now, are the operations. Now, when we add on this workload of this bill, do you really have the capacity? And if the other sub-county, that one, the task force you're talking about, if it came in place, I don't think it will just be there to handle alcohol cases only. I actually think it would be very good to regulate the existing laws that are there than this.
But Honorable Chair, just a question maybe. Maybe I might be out of order. Do you have to tackle the problem? Then number two, is enforcement only for police or every citizen? For example, there's somebody who was asking that as a police, how are you going to tackle corruption? Corruption is for everybody. Corruption is everywhere in this country.
Procedure.
I'm coming to the point.
Procedure, Madam Chair.
Officer.
Whether we are proceeding well, if the officer from the police is going to ask us questions, because
discussion.
all we expect is answers from you. Where you don't have them, you say you don't have.
Okay.
Otherwise, we are asking questions for answers.
Okay. Thank you.
Officer,
Chair.
can we keep to the script? Please answer that.
You asked about corruption. My take on this is, yes, corruption is a very, very big problem in this country. Very complex disease, which is everywhere. We must work collectively. We must work, all of us, as a team in this country. And we fight this problem. Every leader in this country is duty-bound to ensure that corruption does not happen in his area of jurisdiction. This is how we shall manage this problem. That's my take on that. Now, about this implementation of the sub-county model, of course, this is the way to go. And we are going to take it in a phased manner, the way the Deputy IG has illustrated. So we shall first consider the areas with a high crime rate, because
Okay, but to my question, like I had asked, do you currently have the capacity? Yes or no, in case it's passed?
No.
Okay, perfect.
We don't have the capacity, but we are building towards that. Honorable Chair, the other point I wanted to comment about is there's an honorable member who proposed we need to do a lot of capacity building, mindset change, and then dissemination of information. As we rightly noted, we are not everywhere. But if the public knows that maybe it is illegal to drink or sell alcohol during this time, that member of the public can call and communicate, can even call any leader here, and any leader here can call police or whoever is near there to take action. So I believe if we go out there and we teach, we send out information, we shall achieve a lot. Then there's also another concern on what other crimes probably are associated with alcohol and drugs maybe. We've seen sexual and gender-based violence cases also. We've seen murders, even suicide cases, because when some of these people kill themselves and we do autopsy, every suicide case, we have to take off samples for drugs and alcohol levels. And you'll find that some of them, there's alcohol content when results come back from the government analytical laboratory. So there are so many other crimes that are associated with alcohol. Then the other point was on alcohol intake on lakes and water bodies vis-a-vis the income that comes in and tourists and all that. Honorable Chair and members, from my experience, I remember I was in the middle of this bad incident, this the Templar boat accident. And then some other cases where we have maybe few bodies, 3, 10, 13, that we usually handle in this country. It is very difficult to say that maybe you limit only the captain, but you allow the passengers to enjoy. Actually, the problem is not with the captain. The problem is with these people. When they overdrink and whatever, you find they are taking only one side, and then the thing does what? It capsizes. Even some may want even to jump over. When the captain is alone in his cabin, he cannot control these people. So for me, I believe if a decision is taken, even these other people who are going really to enjoy, the law should really be able to catch them. Thank you very much.
Thank you, Honorable Chair, for my opinion as well. And I would like to say something general about the bill. Uganda is amongst those countries of top alcohol consumers in the world, on the top 10 list. Now, there are countries which have also seen this risk early on to not only to the welfare of the state, but also to national security. Countries like Norway, Iceland, and other Nordic countries quickly realized that alcohol consumption or chronic alcohol consumption can actually devour a nation. So they have their own alcohol control measures in those countries. So Uganda should not shy away from the problem. The problem is before us. Somebody asked the question whether, I think, Honorable Chair, you asked the question whether we have the capacity. As my IGP has said, yes, we are building towards that capacity. But recall that we have...
You have said as of now you don't have it.
Yes, but recall that we do have the Traffic and Road Safety Act. I'm just giving you an analysis of how you approach such a problem. The Traffic and Road Safety Act provides for speed limits on the roads because, rightly so, the framers of the law realize that if you allow people to drive at any speed, you will have road accidents. That does not mean that you'll have to plant a policeman every 1 kilometer of the road. So what am I pointing at? That we need also to build technology enhancers. Whenever we enact some of these pieces of legislation, there are technology enhancers or there are areas that we can use in order to aid us in the enforcement. What I've seen within the proposed bill, which may be lacking, is to try and understand how do we enforce positive discipline. Yes, most of the areas we are saying don't, and that is trying to enforce the hard discipline. But how do we enforce positive discipline? What other countries have done is to attempt to look at science to enable this. I'll give you an example. If you're a law enforcement officer in Europe, or maybe you are somebody who operates a heavy goods truck, or you are in passenger transport, you are required to be subjected to an enhanced test for alcohol, chronic alcohol consumption. And probably I will answer the honorable question of what is how do you know chronic consumption? Because you can tell various biomarkers. The common biomarker currently we do have, which is used by traffic, is the breath alcohol analysis. But we do have other biomarkers which are now coming online and which are more robust. Like, for example, there is a biomarker which I'll formulate to talk about it as PEth. And this biomarker has got, we can able to detect this biomarker for over 28 days. And through those limits, if I can give you the limits, we are actually able to determine that if you have this biomarker between the range of 20 to 200 milligrams per mil, you are a moderate consumer. Anything above 200 nanograms per mil, we can determine that you are a chronic consumer of alcohol. Now, this biomarker is very good for us to determine who is a chronic consumption or who is a moderate consumer. And this is something we can use for people like PSV, heavy goods trucks, and other personnel, like, for example, police officers and others. So this is another way of trying to tailor positive discipline so that I'm not at the market trying to look at you how many bottles you are consuming. Probably that's something to think about. The other area which has been talked about is about, for example, people on the boats. As the doctor has rightly pointed out, the passengers cannot be left aside. If you have been on an aircraft, you'll quickly realize that the air hostesses are trained to notice when somebody is intoxicated, and they will stop serving you those beverages. So it is also something which you talked about mindset change, and we need to positively look at the mindset change and looking at other programs. And that leads me to the other issue of why we shouldn't shy away from this legislation, in that the savings that you will realize from healthcare and others can actually be invested into such programs, supportive programs, to drive the positive change that we are looking at. I would also like to comment about the issue of adverts. That is under Clause 17. Just like you did for the Tobacco Control Act, the adverts should clearly stop a beverage seller from alluding something which would entice minors to think that the beverage is something good. I think that's the intention. Probably what I'm looking at is that maybe it was not elaborated clearly, but I think that's something that you need to focus on, because in fact, in other countries, even beverages like Coca-Cola, they're not allowed to be advertised in any form that would entice somebody to consume these sugars. So we are now talking about alcohol. How do you stop somebody from advertising something that would entice a younger generation to think that it is safe for them to consume, whereas not? Let them speak it the way it is, because we have seen all these adverts doing all these things. That said, probably also in the legislation, you need to think about cottage factories, because we have seen also other people can actually do their own home-brewed alcohol as a cottage factory, but how do they bring it on market without abusing the sections of the law you have put in there? And then finally, the issue of carrying firearms in these bars. It is very important to realize that alcohol would greatly impair anybody who carries a firearm. That is something that is clear, and I think the law is clear on that. Probably what now we have to figure out is at what point should you not carry a firearm just because you are consuming alcohol, because of course we have uniformed and ununiformed officers. And this is something that probably we shall have to think about. But we have guidelines that are very clear that for as long as you're carrying a firearm, you should not engage in excessive consumption of alcohol. A glass or two maybe at a lunch or something is not something which would be chronic. But if you're going to engage in binge drinking,
clarification.
A colleague, now that the officer is talking that same question, could we get an answer for that now? What constitutes excessive consumption of alcohol? How many bottles, how many glasses of wine, how many jerrycans of ajono? From your experience, what is excessive consumption of alcohol?
From the available literature, if I can quite remember, the units of alcohol we are not supposed to consume at a single sitting. I cannot have the exact numbers, but you are not supposed to exceed those units at a single sitting, especially if you are doing certain critical aspects. But also people are different. So what we call idiosyncrasies. So people are different. So my single unit may not be the same as the one for doctor. So it's a little bit of a difference. But the whole point here is that for as long as something has got the possibility of impairing you, then you shouldn't engage in it, especially if you're doing critical activities. For example, a goods driver or a security officer. You need to have that level of discipline, because you are doing a critical activity that does not need you to be impaired in any form or shape. That said, you may think that you're drinking maybe half a glass of alcohol, but you're taking another drug, for example, an antihistamine, or you're on maybe some other medication, and that can expound even the effects even beyond what you would have expected. So it is something that we cannot consider in the ballpark. But I earlier said that we can detect chronic consumption over time, and we have the biomarkers and the capabilities to detect that. That if we have somebody here who is suspect to be a chronic abuse of alcohol, we can actually determine that, but over time. So that's why we need to add in these regimens and these new biomarkers, so that we are able to say that if you're engaged in these critical activities, law enforcement, truck driving, border rider, these are critical activities. We have to subject you to periodic checks, so that we are sure that you're not a chronic abuser of alcohol. That way we can stem the downstream effects thereof. Thank you, Honorable Chair.
Clarification, Chair.
Thank you so much. Are you sure you're done? The opinion, someone talked about unproductive persons, someone talked about drinking hours, someone talked about your clause where you said we should drink from home, yet it also exposes the minors. Can't do the clarification, Chair.
Sorry, Madam Chair.
Or you want them to clarification?
No.
Add more before you finish.
I wanted to add one more thing. If
Okay,
allow
you
me,
had
Madam
said you're done, but okay.
I wanted to. Our annual crime report last year reported domestic violence at about 14,681. 14,681 domestic violence cases in 2023.
14,000?
681. 14681. Now, whereas this was a reduction from the 17,698 of the previous year, alcohol was one of the areas highlighted as the contributors. Okay, it was a ballpark because we usually don't disaggregate by through testing to say that, okay, the alcohol abuse, let me test you, but that can be done. But it's one of the, you can actually observe and have that as one of the areas. When it comes to road traffic accidents, the causes of crashes, main cause of crashes, or as they had put it in the ballpark, speeding, and the next one followed as careless overtaking. The ones which have been clearly identified as under the influence of alcohol, only 381. But that's misleading. Why? Because like there's somebody who is speeding, actually is intoxicated, or careless overtaking. Now, this is something that we probably need to enhance, and that's why I talk about testing, that if you have certain violations, we need to subject it so that we can clearly disaggregate. But one can opine that if you're overtaking and careless driving, that could, so the entire ballpark of 6,000 plus the 8,000 plus 5,000 plus the 381, one can link it to influence of alcohol because those risky behaviors are usually associated.
Clarification.
Clarification?
And they will talk about reckless driving, mainly reckless driving. And from his explanation, there may be many reasons as to why somebody is driving recklessly. So where do you conclude that this is as a result of alcohol, so that we take a decision based on the fact that alcohol causes accidents? Because in the absence of that, we can't take a decision on speculation that it may be alcohol.
Honorable Chair,
Yes, please.
we are required to do a better analysis, and also once that happens. But it doesn't happen all the time because of issue of our disaggregation, maybe our decentralizing our capabilities. So you may find an accident has happened in Mitoma, you may not be able to do the test quickly, but you can take. But the report also further says that is one of the areas. This is page 103 of our annual crime report. So we clearly state that driving under the influence of alcohol, the number of offenders who were arrested, the number of offenders for driving under the influence were 1,000 in 2023, and in 2022, 1,006. So those are the numbers detected and arrested as offenders for driving under the influence of alcohol contrary to the Traffic and Road Safety Act. So what I'm trying to say is what we are saying, that we are building the capacity towards that. And we're also informing you that not only do we do the direct biomarker for alcohol, we also have new markers which are able to give us a good understanding of chronic abuse of alcohol, which I think we should adopt. I submit.
Clarification, Chair. Thank you so much. Before Honorable Nekesa comes in, I think when we get these statistics, it will differentiate accidents caused by alcohol, accidents caused by maybe poor mechanics of the car, accidents caused by maybe a narrow road, accidents caused by maybe overtaking, because we all know not all accidents on the road are caused by alcohol. So when we get these statistics, the committees will be able to come to a conclusion whether all these are by alcohol, and they will be able to help out in this particular bill. So when you give them to us only by alcohol, with leaving the others behind, it leaves, the information is a bit hanging, but it's okay. Honorable Nikesa.
Thank you, Chair, and thank you more because now you as the technical people on the corrective side, legislatively, I mean, law enforcement and everything, you are on the corrective side. And yet, we're now being led by technology, like you're saying, rightly so. However, right now, we are facing the Committee of Trade, the part of budget as well I had. So I really think it would it be nice that you also get to involve them in the prevention more, in that since that you have technology that can detect the chronic levels of alcohol in the bodies, maybe also you could advise them that when they're manufacturing the beers, the alcohols, how much in relation, how much the volume of the amount of alcohol per volume, per unit, so that when they plan in their production, they can make different levels, levels of alcohol. So when they're doing, based on the markers you have, what can be comparative? So when they make it maybe lighter alcohol, because we still need to have the money anyway, the trade going on alcohol. Secondly, also in addition to what you've mentioned about alcohol and markers, can you say something more? Because I think the bill is only based on alcohol. How about now that there are lots of toxic substances that are even worse than alcohol, coming in hand, or simultaneously, that the people have alcohol and they chew the stuff or the patches of it. So if you control the one of the alcohol, how about the patches that they use in their bodies and make them intoxicated? Thank you very much.
Honorable Mijuche had something, then Honorable Margaret, then the Honorable Chair, then we give, and the Honorable, and then we give the police side to answer more questions.
You know, Honorable Chair, I have a lot of interest in this bill for obvious reasons. Because when you say anything that impairs somebody's mindset should be avoided, and then we allow people to drink from home, then how then do we enforce such a law? Because they will drink from home and then start driving. But two, in a situation where we have no statistics, one, on accidents, domestic violence, murders as a result of alcohol, suicide as a result of alcohol, where we have no statistics. I would have a problem coming up with a law that's not going to be enforced. I have seen the Tobacco Act, Control Act. People smoke in public. It is not well enforced. I don't know whether it is because of such challenges, but I wouldn't want a law that we come up with and it's not enforced. But also, he rightly says you have no capacity. So, meaning that as of now, if the law was passed tomorrow, you have no capacity to enforce it. So, I want to see what should move me to pass a law where the law enforcement officers have no capacity to enforce it. The issue you're talking about alcohol and reckless driving, and there are people who are driving carelessly because they're on phone. People who are stressed, despite what causes the stress, and because the other time I heard people say that many Ugandans are mad. I don't know what percentage you gave us. So they are part of the drivers. So, why we want you? Because legislation has a lot to do with enforcement. So that you say, now this law we can enforce, then we go ahead. But from what I have heard from you, most of it are opinions. And I expected statistics, data that can move me. And so, maybe we leave it to bylaws and ordinances in different communities where in Karamoja they look at it differently, in Busambara they look at it differently, in Buweju. So at the local governments, the districts, the different communities, because of the different behavior given to societies. So we would want all this from you so that we are guided better. Otherwise, for now, I am still skeptical about going ahead with your proposals and opinions.
Thank you so much, Honorable. We had picked 3, so then police can respond.
Chair, I want to anchor my point on Afande Mubiru's submission on positive discipline versus negative discipline. Afande traffic. Have you ever thought of rewarding anyone who drives well from the time that person gets a permit until he or she dies? The mindset change, the reward that is given to this person. There are people who are repeat traffic offenders. They are there. How about these ones who have driven well ever since they got their permits? You know, can we think of rewarding these people? I know most people are going to think of revenue when we are renewing our permits. But have you ever thought of this person who have gotten this permit for the last 5 years and has not committed any traffic offense? How maybe can we help this person and we say like, on renewal of this permit, this person is maybe charged less. And everyone else knows that if I drive very well, the next time I'm renewing my permit, if it is 300,000, maybe I'm going to pay 270. And the 30 is a reward for someone who drives well. And maybe people can pick a leaf to begin driving well. Mr. Traffic Afande is and looking at how many people have permits in this country. And if we deducted as they are renewing their permits, economically, we can still fit in and we do not maybe rob the government of the revenue. I beg to submit.
Yeah, thank you, Chair. Issues that I would like to seek the Assistant Inspector General of Police to clarify on drugs, and especially narcotic drugs and psychotropic substances have connections with alcohol. Last year, we processed and passed the Narcotics and Psychotropic Substance Control Bill into a law. The President has sent it to, and we expect it to, by now, be taking effect. When we move in our communities, we see that that law is ineffective. What could be the challenge in enforceability? And based on the lessons learned from the laxity or inability to be able to enforce a very useful piece of legislation that should now be biting, how can you assure us that by the end of this session, if we pass the Alcohol Prevention and Control Bill, it will be implemented, it will be enforced by the enforcement agency? 2, we are striving towards the integration of the East African community and getting into Africa Continental Free Trade Area within the context of the AU. And what that means in legal and regulatory framework is standardization for purposes of comparability and uniformity in enforcement within the context of the East African community and the African Union. In the neighborhood Kenya, we have a bill a law, not a bill, that regulates narcotic drugs, psychotropic substances, and alcohol under the umbrella of NACADA that sits in the Ministry for Interior, which is an equivalent of the Ministry of Internal Affairs, based on the spirit of deepening, broadening, and widening the East African community. What are your thoughts as the leadership of the Uganda Police Force in ensuring international collaboration and cooperation in the prevention and control of narcotic drugs, psychotropic substances, including alcohol? Lastly, Madam Chair, is in interagency collaboration. The prevention and control of drugs, including alcohol, from the responses we've gotten from the leadership of the police, requires a high level of interagency collaboration and cooperation. The Ministry of Health has a role to play in medical legal issues as well as the provision of treatment and care. The Ministry of Education has a role to play in ensuring our children are safe, and there are statistics, ladies and gentlemen, that alcohol and drug abuse has infested our education institutions. It's also important that we deal with the Ministry of Gender, Labor and Social Development on issues of mindset change, the Uganda Communications Commission, the Ministry of Transport, and so on and so forth, including the local governments. Local governments have made attempts to come up with bylaws. A typical example is in Gulu, when they enacted an ordinance to prevent and control the consumption of sucketed alcoholic beverages. To what extent do you collaborate with all these agencies? How strong is the collaboration? Finally, this law says the authorized officer has the capacity to seize alcoholic products. Do you have the capacity to do that? Seize, store, abuse in the courts of law, and ensure the evidence does not disappear. Thank you.
Thank you so much, Honorable. I think we had one more, and we go back to the police officers. Honorable.
Data aggregation for the traffic response I had through Afande Mubiri can enhance our reporting. And if you can submit a report that out of the different traffic offenses committed, that this number were attributable to alcohol, it can be a good justification for us. On the other side, lack of data does not bring us any justification not to make any law. That is our role as lawmakers. We shall make. On the other side, again, the incapacitation or the capacity or lack of capacity of the police force to enforce the law is not any justification for us not to continue making any law in this country. We will continue to make the law.
Point of order.
Point of order.
Is the honourable member in order to answer the questions? Close and sit on their side.
Thank you so much, Honorable. Honorable Fidra, you're still part of our team. Please leave the police.
All right. Okay. And now, blaming alcohol consumption as a cause for domestic violence without data will be an injustice that the police are providing for the members of parliament to continue processing this law. Just equally, I said with the traffic, it would be very important for the police to submit a disaggregated data on causes of domestic violence related to alcohol, because there are so many causes of domestic violence. infidelity, sexual abuse, mention them, poor communication, poverty, late coming of many things. You can't, as a police force, in this report, blame alcohol to be the cause of domestic violence, so that we come up with these punitive measures of the new law. I would really agree with my members that the current existing laws might be sufficient for us to continue implementing. I submit.
Honorable Gaffer, then our chairpersons. Finally, we move to police.
Thank you, Chair. Two things. The first one, I want our police to make a comment on consumption of alcohol for many people, either as a stimulant or as a depressant. I want a comment on that. People who consume alcohol, just like any other drug, as either a stimulant or a depressant. There are people in the community who cannot do anything until they have swallowed something. And for them, including digging, cultivation, and for them it is a stimulant. So I want a comment on that. But Chair, I see the IGP and team are dodging the question of time of sale and consumption of alcohol, which is key in this bill. I want to repeat it so that they don't dodge it. And it is on two fronts. You know, when you limit sale and consumption of alcohol to 10 p.m., many of them we have already said they should not buy alcohol in uniform. The time they go back and remove the uniform, it is around 8 p.m. So when will they buy? Many of the people, including the working class, will want to drink in the evening after work. You leave office here at 5, 6, you struggle with traffic jam. By the time you reach home to freshen up, it is already 10 p.m. So when do you go? But the most importantly, Chair, and the member had already mentioned, have you considered the economic value of alcohol consumption and sale? Look at the tourism industry, but look at the night economy generally and what it contributes to the GDP of this country. So, and that includes where our salaries come from, including you senior officers. Do you know where the money that pays you comes from? Much of the money comes from the night economy. I want you to comment about the timing as proposed in this bill. Even if we say, okay, whatever we are saying, control, I want to talk about the timing. So do we stop selling alcohol at 10 during working days and at midnight during weekends and public holidays? Thank you.
Thank you, Honorable Chairs.
Thank you, Liz. When you say you have no capacity, and then again you say you have 47,000 policemen, of which you're also going to add another 3,000, making it 50,000 policemen. Actually, to me, it is not no capacity, but then it means you're incompetent. If you had indicated that capacity is limited and not sufficient, I would understand. But when you say no capacity with 50,000 officers, that is incompetence, not lack of capacity. So I want clarification on that statement. Secondly, I was excited when I heard that amongst you have persons with, in charge of forensics. And what we expected was actually forensic data. In many countries, when they talk of, if you say domestic violence is alcohol related, you must have actually measured the blood alcohol concentrations to call it an alcohol related domestic violence incident. When you say a car accident is alcohol related, it must also be linked to the blood alcohol concentration levels. So I want you to just clarify. Yes, you may not have investigated all, but
do you carry out investigations, forensic investigations for those car accidents? And if yes, you did, how many of those were alcohol related based on forensic data? Because when you begin to say it could have been careless driving, reckless driving, then it doesn't then help us address the issue, because it means it could have been anything, you know, because you're giving multiple causes. So I want a clear answer from the police based on the forensic data that you have. Thank you.
Thank you, Honorable Chair.
Thank you very much, Honorable Chair. I only have two issues for clarification. First one is that Parliament is a house of records. I heard from Dr. Beruhanga in his defense of the proposed amendment of Clause 1 to include water vessels, which a majority of the members had passionately said the element of the health of our economy is very important vis-a-vis the number of incidences on the water vessels. Honorable Chair, on the 14th of July 2020, there was an investigative report of an incident he mentioned of MV Templar, which was one of the most tragic water accidents that happened. The Minister of State for Transport presented to Parliament 10 reasons for that particular accident. And of the 10, none of them is related to alcohol, like Dr. Beruhanga mentioned. I want to find out from him, because sure, this is a house of records, whether he has an alternative report, because I believe these are some of the incidences that will certainly come to the floor of Parliament. That record is available on our Hansard. Secondly, is that Parliament certainly also bases on reliable data to legislate. And much of what has come forth here are opinions. I asked a question on one of the interventions that police had at some point, popularly among people, the Ugandans, called Kawunyemu. And during this Kawunyemu or checking for drunk driving in the nights, they would use breathalyzers. And then this particular operation died after a very short stint. I had asked why, in particular, this fight, I think this was the most outstanding operation by the police. Why did it all of a sudden die? And why do you think now, with these new interventions, you'll be able to even operate better? Yet this one was only within Kampala and only at night. And now we are talking about nationwide and maybe throughout the day. What's the guarantee that you'll be able to sufficiently handle this operation?
Thank you so much, Honorable Chair. Police, as you come in to respond to the Narcotics, Drugs and Psychotropic Substances Act, which I think was also very pertinent. Up to now, police has not been able to implement it so well. So what makes police think that this particular one will be implemented so well when we've had earlier cases of certain bills that are more or less in relation to the one we are handling, not implemented well? Probably it goes back to capacity. Then finally, I would like to draw your attention to the COVID season. In most of your submissions, and I heard Afande Mubiru emphasize, and Afande here and the Deputy IGP, that alcohol has been a major cause of domestic violence and you have even given statistics. If you'd remember very well, during the COVID season, majority of the bars were closed. But oftentimes on news, whenever we'd watch news, we really saw police reporting on the increase on domestic violence. So now it brings us to think that domestic violence may not entirely be an alcohol issue. That is why colleagues are asking for statistics, because we saw in COVID, domestic violence was there, bars were closed, people were staying home, but police were still reporting those cases. So when we ask for statistics, we really want to differentiate this and also to make work very easy for police. We don't want to burden police with extra work when the present work is equally hard. So police, now you could answer. Please make sure you answer all their questions. I wish you were writing down by name, by what. It would be easier not to miss out any. Thank you.
Well, thank you, Honorable Chair.
Before you
of Uganda. I'm Dr. Batua Timothy Lusala. I represent the people of Ginger City, specifically Ginger West. I'm a member of the Committee of Health and a very important matter in my ministry. And I'm here with my permanent secretary and the entire ministry. Thank you very much.
Honorable Minister, Shadow Minister.
Sorry, Shadow Permanent Secretary, because somebody was attempting to look for the permanent.
Thank you so much. So could we move to police now?
Thank you, Honorable Chairs. The questions that have been asked, let me first clear this, that we don't have capacity. What is there that we have, but not as required? There are gaps in the capacity that we have. Then two, Chair, of course the discussions, what we see is that data is very, very critical in this matter. And without proper data, we may not go forward. And I agree with the honorable members that for us to take a good decision, we must have data. Yes, the data, we do have the data. What we require is for us now to present it the way that satisfy the subject matter. And I think we shall strive to present that, because when you look at the questions that have been raised, especially on the timing of this proposal, both during weekends and weekdays, still you need data. When you talk about the night value or the economic value, the night economy, you also need data. Because when you talk of alcohol as one of the areas where we get revenue, then you have to look at it holistically. For example, at what time does this money come in? Is it when people consume during day, or is it when people consume during night? Now, looking at the data that comes, then you are able to gauge what time should we start, what time should we stop. So you can see, right now we may not come out clearly with any, concrete suggestions or resolutions. That means we still have work to do. Indeed, the Anti-Narcotics Act is in place and it's being implemented. But of course, members can never know that it's being implemented. We're still without data. So all this needs to be brought on board. But what we have done so far is that when this act was sent to, we created a department within the Directorate of CID, that is the Anti-Narcotic Department. And currently, I'm told what is being done is we are in the last stages of developing the regulations. And as I say, these laws are not done in isolation. We are already implementing, only that we now need to come up with the data. How far? What are the statistics in relation to this act? Which I think with our continued discussions, we shall provide them. Then a member also talked about integration of the East African community and how are we relating with our colleagues in other countries. We definitely, as you know, on the broader perspective, we have the Interpol, and also we have the East African Police Cooperation Organization that brings together about 11 countries within the East Africa. We discuss issues to do with transnational crime, trafficking in persons, and also those related to trafficking in drugs. So we have that. In addition, we also have the Northern Corridor, which brings together 3 countries of Rwanda, Uganda, and South Sudan. So, in addition to our cooperation internally here with our sister security forces. So, those things are there, we are cognizant of them, and we work together within the East African arrangement. So, Chair, maybe others will talk about the COVID and the Kaunyemu, but I still think we need to provide you with this data. And once we provide the data, then some of the questions that you have definitely will not arise. So we shall go back and then ensure that we provide the required information. Chair, I submit.
As you hand over to your colleagues, the officer had stated it very clear. Later on, you edited it. But as we are discussing as the committee, because colleagues have raised the issue of capacity. So, Deputy IGP, would it be right to state that currently you have no capacity to implement this bill as police?
Chair, the wording, the right wording was supposed to be
the right wording is a yes or no?
No, it is a low capacity. We have gaps. I clearly stated that it might be difficult to enforce the law in all areas in the same magnitude because of low capacity. For example, we had the honorable member who stated that she has the whole, is it the whole district, 85?
Yes.
85
From Mbarara.
So Mbarara has so many villages. Yeah, that's what I'm stating. So you may not find that you have capacity in all those.
So you don't have the capacity?
It's limited. But we are in the process of building capacity. Currently, we have people who are training in Masindi. The training has just started. So every year we are building capacity. We are also doing internal training. So it is a process.
Say, Afanda, we don't want to burden you more.
Yes.
On top of the limited that you have, that has loopholes, then we add on more.
But the Honorable Chair, also a member, I don't know whether I can say he stole for us the exams by stating that.
That one will withdraw his statements. He's not part of you.
So that can't stop the country from putting the law. We should put the law, then we find means of building capacity in order to implement, to enforce.
But we don't want to put a law that will be redundant also.
No, it cannot be redundant. I don't think so.
Like the one the Deputy JIP has talked about, the narcotics one. No, it is hardly felt as it is as of now, yet it was passed last year in more relation to this. So that is why we are worried as the committees.
No, Honorable Chair, we also got an answer somewhere. Interagency collaboration. As I stated earlier, these laws in the country cannot be enforced by only one agency. You have to collaborate. So there are other players. Even if police is not in a particular place, and you, a good citizen, you notice that there is somebody who is entering with a gun, maybe in some place, you can send a WhatsApp or you can call to somebody who will come and enforce the law.
Okay.
So you are also enforcing the law.
Okay.
So we are saying, oh, this is collaboration, interagency, interpersonal collaboration, which is very, very important. And in these laws, this is the way to go. Capacity building, interagency collaborations, and then research, Honorable Chair. Not only by police, by also means of health, the effect of alcohol on sexual and gender-based violence, on so many others. Alcohol alone, not only the police, but research by even means of health, they can help us, they can help with the statistics in this area. There was another point on alcohol, stimulant, depressant. It is very true. In the pharmacology of alcohol, at first it is a stimulant. But when you take more and more, then you'll go into depression until when you become unconscious, and it can even kill when you reach those levels. So those are levels in which people can go through, and it is true, it happens. So the other area maybe is on narcotics. My colleague forensics will take on that, will comment on that. Thank you.
That one, the Deputy IGP has answered. Please try to answer what the honorable colleagues asked.
Specific with him on the issue of the MV Templar, the record, because...
Honorable Chair, I don't have any other alternative report. We shall take that report that was presented. Thank you.
You withdrew yours.
So you withdrew yours, we take the Honorable Chair's report. Thank you so much, Afande. Next one. Absolutely. The ladies, do you have anything for the committee?
Thank you, Honorable. Am I failing to use, or it is one? Honorable Chair, let me speak for the ladies, because I like to do that. My name is Chelimo, I work with CID, and I want to speak to the statistics, Honorable Chair. 10,681 cases of domestic violence for the last year. It is also true that not all of them are caused by alcohol, but it is true that some of them are caused by alcohol. And like my IGP has said, we are going to segregate and then share with him the details of those that are attributed to alcohol. It is also true, Honorable Chair, that we have 14,846 sexual-related offenses, and some of them are also attributed to alcohol. We have cases of rape and defilement. So it is not a guess, but it is a fact. We shall share the statistics. And I want to add my voice on my IGP's statement that laws are not enforced in isolation. We shall enforce this law together with others, continue to use the existing resources as we build on the force. I thank you, Honorable Chair. I hope I have resolved the problem.
Thank you so much, Honorable Lady.
But
someone asked the question on time.
On time, Honorable
Yes,
Chair,
time.
I think the IGP can answer, but if you can allow, I can just comment on the anti-narcotics and psychotropic substance law. Before the enactment of that law, we have been using the National Drug, my land friend here, yes, Act, because it has provisions of offenses of trafficking narcotics. And that explains the existence of a fully fledged department of anti-narcotics. And Honorable Chair, you may have seen pictures of persons that are held at the airport or other exit entry points with narcotic drugs, either ingested or in concealed bags. So the police has a department that handles that. And with the new law, it supports us in enforcement because of the many other provisions of the offenses that can now be enforced. But my colleague has just reminded me that the law is pending commencement, the law, and the regulations are in the final stages of completion. And we are here to enforce. Thank you very much.
Thank you so much. And I decided to buy my crate of beer in advance. I keep it to myself. It went back to Honorable Mujich. I think he also talked about the amount of consumption, which one would be excessive. So I have kept my beer here in anticipation of 10 p.m. bars will be closed. And Honorable Gaffer actually even cited leaving Parliament at this time. By the time you reach home, you're coming back. Even you police officers. I'm sure you also enjoy your weekends. And then the Honorable also, someone still cited something to do with the economy. We have seen that these bars are not in isolation. There is a bar here. Around it, there is a border stage that is waiting for the passengers to go home, for the workers to go home. There is a chapati Rolex person. There is a muchomo somewhere. So there is a sauna somewhere. Then there's a honorable lady who talked about, I think it was for supermarkets and what. Still in addition to the supermarkets, you see someone is selling in supermarkets, but we are not talking about the hotels. The hotels are there, they have their drinks. The tourist areas are there, deep inside in the forest. But we are now looking at these small places, the bars. And then again, in your own observation, wouldn't it be unfair? First of all, unfairly, that would be unfair trade, because you're exempting some and closing out some. We are saying bars close at this time, but hotels keep open. So that is unfair. And secondly, wouldn't it also be unfair? You have been very good people, human rights. We are saying, you people be in your nice hotels and drink. Now, us in our small wood-be fundas, please close at this time. Isn't that also unfair in its nature?
Chair, Madam Chair, on that, there is also the shifting working hours. Some people work during the day, others work at night. So if I am working during the day, if I'm not working during the day, I'm going to work at night. It means my night is day. In the day, so that I prepare to work at night. Working hours have shifted world over. You find people sleeping while others are working. Others are working, other people are sleeping. So how will you, again, it goes back to enforcement.
Thank you, Honorable.
That become problematic.
But Chair, for me, I think I raised it that the police, the enforcement guiding trade, the trade people,
yes,
on the amount, the equivalence of the meals, the alcohol content in a bottle that you manufacture for sale,
yes,
to the science in it that there is so much particle of the bad one that can cause intoxication and that in that line. I think that's important. That the guide the trade, the guide the economics, that we don't lose out in either way.
Thank you so much, Honorable Nekesa.
Chair, also, during the functions, all parties buy, what are they talking about that one? Because it is in the bill also.
And also in the traditional ceremonies, adding on his, we've often seen traditional ceremonies, and I have carried them there. They are not in a bar, they are not in a public space, but they're in someone's home and they are being consumed. I think that adds to what the Honorable is trying to point out. But also, you would also be, Honorable Gaff, I think, talked about it, or Honorable here, talked about the economy. The number of business people who are involved in this. We are, don't get us wrong, we are not against the bill. There are some parts of the bill that are very, very good, and there are also some parts that are very, very unfair. Because when you look at the whole entire value chain of this bill, as they call it, the alcohol, you look at the economy, those that are in the industry, those that are in manufacturing, those that are in selling. We are looking at the farmers who are growing the grain to support these industries. We are looking at our Honorable said that they are surviving. He went to school, probably even most of you, from their parents selling this. So it's a broad.
Actually, Chair, the biggest producers of barley are from Afande Chelimo's place.
Proposal suggestion. From what is coming from the members, why don't we maybe propose that we look at concentrations? Permitted an offense, irrespective whether it's nighttime or daytime. Internationally known that if you are found out of this range, that is my humble proposal. On this court, along that item of time range, irrespective of when you have taken the alcohol.
Thank you so much.
Thank you.
To have a few, we speak about regulation of alcohol consumption. In 2012, we handled what the honorable member is called. I didn't know there is an association of alcohol consumers in this country to ensure that Kaunyemu stops. And we had a few, those who brew alcohol, the breweries, came to our rescue. Nairo breweries and Bear breweries, which is situated near Ruzera, I think, Uganda breweries. They came, reinforced us to talk about regulating consumption of alcohol. And there is a study which was conducted by them, but I'm also sure it is not published because we were dealing with the situation at the time. When we had those operations, the prominent bars in Kampala, I still remember them, Angenois, Crab Silk, California, were in the middle of the town. They were there. Now, when we started the operations, many bars started coming up in Chanja, Chaliwajara, Namugongo, Chira, Kasubi, name these suburbs. And alcohol consumption increased, sales increased, and that is why they came to support us. And they supported enforcement because we managed to reach some prominent bars like Bamboo Nest at Bugorobi. And we had a red card campaign that when the owner of the bar and those who serve there see that a table is now with the people who are so hyper or depressants, they will know how much alcohol they have consumed, would raise the red and say, no more alcohol here. And we moved further that special hires could come nearer. And they would advise, there are special hires if you are driving, let them drive you. During that time period, the global report on road safety mentioned something about Uganda on how it managed to reduce some road fatalities. That report is there. Now, we need to look at this issue of alcohol. It is a huge problem, and police cannot handle it alone. This brings me, Honorable Chair, that I must now see two words. There is police and there is policing. Policing is an activity. Police is an institution. Police is an institution and mandated to do some, policing activities. But policing as an activity involves other institutions that can do policing. And this is where I will agree with the honorable member here who said other agencies. Collaboration with other agencies is is a component of modern policing. I would also like now to move further because I may take long, but let me move further and talk about the statistics. And this is the road safety approach. The statistics alone you get the figures, and those figures may not explain much. You need to go and have the analysis of these figures and find out a few things. Honorable Mwishuche, you mentioned, you had questions that appeared to be like research questions. But look at this issue. The statistics, when you get statistics, look at a few words. One, severity. Severity. Secondly, risk. And the third one is vulnerability. Now, those three terms have levels. Therefore, when we talk about alcohol, how severe is the outcome of my action when I have taken alcohol? If I have taken alcohol and I drive, and I'm involved in a crash, how severe is this crash? Two, the risk levels. If I spend the whole day drinking and the evening I'm going, and I'm going to drive, is it more risk than if I had started at 4 p.m. and took 2 beers? Is it more risk? What are those risk levels? The vulnerability. For road safety, the vulnerable people are these cyclists, by the way, and these pedestrians. Now, some of them have been knocked near a bus, and a bus sweeps someone, and tomorrow when you discover a dead body in the bush, you think it is murder, until our doctor does post-mortem and say, no, it is a different thing. But the reporter will report maybe it could be murder. But this old man had put his goats into the shelter and goes to spend time drinking waraji. And as he's going home on the vulnerability level would have been low. Therefore, in road reducing vulnerability, reducing the severity. How to reduce those context of reducing the risk. Isn't it? That I can drive and die? Isn't it? I would like also to mention one comment. That problem. Actually, the Road Safety Act here, which I have, is very good. And it has been here for some time. And it refers to this Narcotic Drugs and Psychotropic Substance Control Act of 2016, which one member was talking about. The holes may be there because maybe the regulation is not in place or is not amended or something like that, the regulations. Sometimes the regulations take 2 years, 3 years, and that these acts are in place. Can we quickly, all of us, as all of us concerned, ensure that the regulations, we put pressure on the Honorable Minister and say, please, can we have a regulation in place? It will, that process will sort out a lot of... the consumption, the excessive consumption of alcohol, of Honorable Mujuche. Excessive consumption of alcohol, liters you have taken. In road safety, we look at what the law says, if it is in place. And for us, we have the alcohol limits, prescribed alcohol limits. Beyond that, you have taken excessive. Secondly, Honorable Chair, it is difficult to quantify in terms of glasses and the amount of liquor. So, because I knew we would test and we had breathalyzers, he had taken a drink of Bachiga called Ntulire. And he moved away, having injured him. So those different percentages of alcohol will determine, and we see whether there are so many people who drink productivity. Now, for us in road safety, we look at labor productivity. We may not go into medical during the day, during the night, the productive levels will reduce. Actually, so we need to deal with alcohol in that perspective of labor friendly. Some of us, we shall drink and keep quiet and not talking. Others will now, the voice of someone is on the steering and he can't engage a gear, he's there and it is inclined, the vehicle is inclined and he can't move. To see the fellow is drunk. Someone gains speed and all the actions gain momentum and he drives on high speed. Now, the risks are high in both incidences of the present and the risks are high. You will be knocked by a speeding vehicle because you can make an inclination abruptly and stop. Or the one who is hyper can knock a person and die, or himself die. I think you know all these crashes resulting from this. So when we give statistics, we need to engage with you further and make an analysis, and we come with a conclusive, idea to save our Ugandans. We want to save Ugandans and reduce the alcohol. Madam Chair, lastly, sorry, but on time. Should we have to allow, a laissez-faire and say, please, the whole day you can drink? This taxi driver will jump on booze and then jump in a taxi and drive. The child you have left at home of A level will get into a room you have left at home and enters into a building. So we need to look at time. Without compromising so many issues, we can have a few discussions from different stakeholders and then come up with a concrete idea. But we should not allow 24 hours of drinking alcohol. Thank you.
Madam Chair, I have not... You find drinking from morning to evening and not people who have left their jobs and going to drink. There are a few people who will definitely leave jobs and go and drink, but many people are drinking because they don't have what to do. They are idle. Many of the people drinking. So when we talk about productivity, we need to link it to these people who are just drinking. They have what to do, and they just left and started drinking. Otherwise, we may end up speaking very well, and I find I want to say I'm excited by your discussion, but it's general. As we address the bill, we need to look at those and say, yes, productivity. How does it come in? Otherwise, whether severe, whether it risks, at the end of the day, we need to address the bill as it is now. Because we can amend, but as it is, it's what we are looking at. Are we addressing the bill as it is? As it is, if we pass it into law, will it help? Otherwise, I get you on the challenges of drinking, I get you on the risks involved, but if we don't address the bill as it is, it will be any other document.
Thank you, Honorable. As you conclude.
There are just two aspects of policing. He drew a very good line between police and policing. There are two aspects that are not coming out clearly, yet very key in our drafting of this law. That is deterrence and punishment. This law that we are making, at the end of the day, we shall reach consensus on all these issues that are controversial. But after reaching consensus, normally we have a clause in this law that causes deterrence. And that very clause or another clause introduces punishment. Now, my worry is, you talked of the traffic police enforcement. My worry is that this alcohol law and the way it looks, it has very many offenders. If we load these offenders into the existing legal system, the courts, they will be overwhelmed. And I know you're coming on board with the experience of the traffic offenders, who were also enormous. What I saw in Kenya, I believe in Uganda it also happened, that the moment you're caught there and then you're put to a court, I don't know who was sitting in that court, and you're made to pay a fine. You get it? So maybe rather than us recommending prison sentences and overwhelm our existing system, can we borrow some of the knowledge how you were punishing the traffic offenders, because I believe they are in equal magnitude to the ones we are likely to meet here. How can it be so simple yet deterring in nature? Yes, thank you very much.
Thank you, Honorable Minister. As you're submitting, I equally listened in vividly. To me, from your Traffic Act submission that you've given, it looks like we need more of the sensitization on the alcohol abuse than a law. From your submission, because you have given us how you went to the bars, how you told them not to drink at this time, how you have tried to engage bar owners, and you have engaged the special hires, you have met all those people. So from your submission, sensitization about abuse of alcohol would be the way forward than the law. Setting up a law to start, don't do this, don't do this. Like you had earlier said, policing and police. Going by the red card. I think that goes back to sensitization. That is what we need as a country, right?
Chair, yes. And enforcement of this law has those components you are talking about, Madam Chair. The Traffic and Road Safety Act gives the prescribed alcohol limit a driver should have. So we started with Kaunyemu.
So that is what he's saying. Is it sufficient? It is working well. So we just need to add.
Honorable.
Yes, Afande.
Honorable Chair. In my submission, I was clear. Necessary and a sufficient condition. The law is necessary, and you shall not run about it. You can't run away from it. Then it is not a sufficient condition. Now, when the law was there, we brought breathalyzers. When we started breathalyzing the offenders, now there was something that it had to be done in order for our enforcement really to succeed. And this is where the sensitization came in. This is where all those other components came
and it is working.
Support us.
And it is working. Please. And even now it is working.
Honorable, COVID. Someone said we didn't speak about COVID. COVID grounded our breathalyzers. We couldn't use the breathalyzers because we were stopped because they would be spreading the, I think you remember this common knowledge. Now, after some time and writing.
But we are also not moving, Afande, we were at home, COVID time.
Yes, and you were buying it from? No, from, because shops were allowed to operate.
From online distributors.
Online distributors, all those people
So
are
it not catch
distributing.
us.
So we, honorable members, Chair, we need a law. This is now a necessary. It is necessity. But a law itself is not sufficient.
Thank you so much, police. I think you have made enough submission.
Honorable Chair, punishments that involve taking somebody to prison, if we decide to do it the traffic way, where somebody is given an express penalty, you pay money, is that deterring enough in your view because you've done it, and how was it in traffic? Is that deterring enough if we take that route?
Honorable Mubiru, he put up his hand.
The number 5 here says harmonize the sections of the traffic and road safety on oral core, and so it mentions section 111, 112, 113. Now, the punishment is prescribed, and the law says 300 currency points, and this amounts to 600 Uganda shillings, I think, 600,000 Uganda shillings. Do the quick calculation, you can get it. Then, or 3 years imprisonment. But the express penalty is applied, and someone pays 600,000. Yes? It is 6 million. So, if you paid 6 million, then that is okay. It is deterrent enough, but we have not taken congest.
So it goes back to his question that the current one is working. What doctor is saying, from what you have right now, what you have explained.
Chair, that is difficult because, you know, in the Traffic and Road Safety Act, and where they implement the ESP,